Okay, so this is if we have a, it is actually kind of a gapping technique of the SI joint, and you can use it as a gapping technique, but it's more difficult than the other two gapping techniques that we did yesterday. But essentially, we now have a right anterior sacral base. Okay, so we want to pull it posterior. So it's on the bottom side. So it's the bottom side retreating. Scoot forward towards me. Okay, so if we want to pull it posterior, we're going to pull that lumbar spine into a little bit of flexion. So we only have to flex into through L5. Okay, so we're taking that flexion up. And it looks very much like the lumbar techniques, with the exception of, instead of being on the pelvis, I'm going to be on the sacrum. So I'm coming way back in here. I'm going to fix L5 so it doesn't come with me. And I'm going to get on the sacrum. Right there I'm on the sacrum. And when I get on the sacrum here, I'm leaning. So what I'm essentially doing is gapping right here. And as I lean on this left side of the sacrum, I'm pulling that sacral base posterior. So the manipulation is that. Okay? The next one is if we have an anterior fixated, I'm going to have you on your belly. And you're going to put your left leg on the ground. So table height matters just a little bit when you're doing the leg off the table, because we don't want any torsion in the lumbar spine. So it just depends on how flexible they are. But I do want him to get uptight in his hamstring. So he's going to pull that. So now we have this joint that's posterior that we want to go anterior. So we're going to pull the ilium into full posterior rotation. And I'm going to just take you out just a little bit because I don't want that twist. There we go. We're going to get right on that sacral base, and I'm going to get my knee right behind his hamstring, and I'm going to get this hand on the ilium. Okay, so I'm going to do a two-handed technique. I'm going to be right here. I'm going to get a little muscle energy help right away by having him push his hamstring into my knee. Good, and relax. Easy, buddy. There we go, and there's the barrier. And so then from here, it's a straight arm technique. You just feel that a little bit. Sorry.
No,
Okay. All right, and then we'll look at Fred's.